What is Medicare Advantage? Hi there, Joe Valenzuela with Vista Mutual Insurance Services. Let's talk Medicare. A Medicare Advantage plan is another way to get your Medicare coverage. Medicare Advantage plans contract with Medicare to provide services equivalent to Medicare. They are paid a fixed amount monthly to cover the cost of your care, and they must follow Medicare rules. If you join a Medicare Advantage plan, you'll get your Part A, your Part B, and usually your Part D from the plan. We say usually because not all plans include Part D, but most do. You also may be required to use a specific network of providers. And you'll be subject to the premiums, coinsurance, and copayments of the plan that you select. So you just throw away those original Medicare copayments and coinsurance, and you just go by what your plan says. So Medicare Advantage is just a way for a private health insurance company to administer your benefits, and you have to have Medicare in order to be eligible to get a Medicare Advantage plan. So if you decide to leave one in the future in an enrollment period, you would revert back to original Medicare. All right, so there are different types of Medicare Advantage plans. The most prevalent is an HMO, which stands for Health Maintenance Organization. All that means is there's a specific network of providers that you must go to. You have a primary care physician, and they have to give you a referral to see a specialist. The next most popular is a PPO, which stands for Preferred Provider Organization. And kind of just like it sounds, it means that they have a list of preferred providers that they prefer you to see, and you get a lower cost share for seeing, but you can step outside of that list and see any doctor that will accept the plan. You also do not have to have a primary care physician, nor do you need a referral to see a specialist. There are private fee-for-service plans, PFFS, but there are not that many here in Northern California where we operate, but in other states there are. And basically what that means is that the provider can choose whether or not to accept it each time that you go in. So that's why they're not that popular here, but there are still some that exist. Very popular plans though are special needs plans, SNPs. Now, they're designed for a specific group of people, and there are C-SNPs, C as in cat, and it stands for chronic, which means if you have something like congestive heart failure or diabetes, there may be a plan specifically designed to help you with those. Also, there are D-SNPs, which stands for dual special needs plans, and that's available for people that have Medi-cal here in California or Medicaid in other states, and Medicare. So those plans coordinate with Medicare and Medi-cal, Medicaid, and get a really good benefit structure for people that are lower income. Also, these plans usually include Part D. They don't all necessarily, and sometimes if you join a plan that doesn't have a Part D portion to it, you cannot add a Part D portion to it. So that's where it's good to talk to an agent like us, and we can flesh out all those things for you. Also, plans are offered in specific coverage areas, and not all areas will have all plan types. So these plans are usually offered per county, sometimes even in zip codes per county. So it's, this is again where an agent comes in. We can look at all the options that are available for you based on your zip code and tell you the differences between them. Now also, plans have varying premiums, coinsurance, and copayments that are different than original Medicare, like we just talked about. So it's really good to sit down with an agent, compare your options. They can tell you what's available in your county, and then you can make a good decision about what type of plan that you'd like to have. That's going to do it for types of Medicare Advantage plans and Medicare Advantage. Thank you so much for joining me on my never-ending quest to make Medicare simple, and I hope you join me next time.